We've seen a rapid escalation in the response to coronavirus, and right now we want to help answer the questions that you might have.
That's right. We have Dr. Danny Avula. He's the director of Richmond and Henrico's Health Departments. Dr. Avula, thank you for being here.
So glad to do it.
One big question. We heard the president today talk about testing sites. How might that look in our area? What are we learning?
Well, I will say that the biggest challenge that the U.S. has faced in regards to testing has been that we haven't been doing enough of it. We have not had access to testing to be able to really accurately identify just how much disease are we dealing with in our community, and that's really hampered our ability to make good data-driven decisions. So this news is very welcome. The opportunity now, if new money's coming in and testing is being made more widely available, it will really help us get a better sense of how many people in our community have this, and how then will we use that information to open schools back up in a couple of weeks.
Talk a little bit about anxieties and people's tendency to want to panic somewhat.
Sure.
Cancellation can save lives. Canceling events also causes anxiety, panic, and concern. Schools are out. What is that conversation? What should that conversation be like for families and parents, to kids who are out, to people who are running small businesses and not sure whether a daycare center in their home, and they're not sure whether or not they should close?
Yeah.
What is the conversation about to make sure people keep a grip
Yeah.
on what's happening, but still operate in a safe manner?
Well, I do think we just need to acknowledge that, this week, unprecedented things have happened in Virginia, throughout our country, and it is, the decisions that have been made will obviously cause a certain amount of anxiety and concern among our population, and we understand that and we hear that, but I think it's also really important for the public to understand that these aren't decisions that we've made out of fear-based reaction, but that these are the kinds of significant interventions we need to put in place if we want to stem the disease spread. So there's a lot of talk about this idea of flattening the epidemic curve, flattening the curve, and the way when we watch communicable diseases spread throughout communities, it kind of follows this bell curve. It starts to peak, and then after a little while it starts to wane. The problem is, if it peaks too quickly, as great as our health systems are in this community, and we have great ones, we do not have enough hospital beds to save every life that's going to need it. So we have got to slow down the spread of disease and flatten that epidemic curve so that we save enough beds so that when elderly individuals and people who have underlying health conditions who contract the virus, that they can actually go and be treated in the hospital, and we have a chance to save their lives.
What are the symptoms, and what should a person do if they are experiencing those symptoms?
So one of the challenges around this virus is that the vast majority of people who get it, somewhere between 80 and 85%, have very mild symptoms. Maybe a cough, some congestion, maybe some fever. In about 15 to 20% of individuals, you have more significant higher fever and respiratory issues. About 5% of the population is actually going to need intensive care unit hospitalization. They might need ventilatory support or other interventions.
So
Cough, congestion, fever is what we're really looking for.
That's the key.
Yeah.
And are they
Sound like anything else?
It does. It does.
Someone asked me on Facebook, and I promised I would ask you, if you get the coronavirus, are you immune from getting it again if you heal from it the first time? Do we know the answer?
We don't know the answer yet. There's the way that viruses works, your body does develop some antibody resistance once it's been exposed. We don't know if this is a virus that's going to mutate frequently like the flu virus does. The flu shifts slightly from year to year. So the hope is that there is some immunity that will develop by exposure, but we just don't know yet.
A lot of unknown and a lot of just kind of walking through this thing as we go.
Yeah, absolutely.
Dr. Danny Avula, thank you for your time.
Thank you. We appreciate you.
Glad to be here.